Okay, let's talk about your surgical options for hair loss. These are mainly FUT and FUE. In our office, we have PUE as well. And in the past, there was plugs. Let's just kind of walk through all these so you know the difference between them all. So back in the day, plugs were times where doctors took a little 1 centimeter punched out a cluster of hairs, usually about 30 to 40 hairs in the back of the head, made a little incision in the scalp, placed that plug of 30 to 40 hairs in, and let that integrate within the body. Over time, that plug contracted such that all those hairs clustered together and formed like a little sprout. And that's why we got those unnatural appearance of plugs back in the past. However, that was a big revolution in hair restoration surgery. We no longer cut out pieces of the scalp that were missing hair. We were actually able to transfer hairs over. That then progressed into the technique called FUT, which still exists today. And if you look at a lot of hair restorations that people had 10, 15, 20 years ago, they're mostly FUT. This is when they took a strip of skin out of the back of the head, put it on the back table, and they splice it up into the hair follicular units. Now, a follicular unit is not a single hair. It can be 1 hair, 2 hairs, 3 hairs, or sometimes even 4. Hairs are grouped in like little clusters called units. And in FUT, those follicular units were then implanted, either single, double, triple, or quadruple hair grafts. It looked a lot more natural than a plug. And because the entire piece of tissue from the back of the head was with that hair, the results tend to be pretty good, and the survival rates of the hairs tend to be pretty high, and the results were pretty impressive. However, you had this big linear scar on the back of the head, which was painful after surgery and can look pretty horrendous if not appropriately put together. But even if appropriately put together, sometimes just didn't heal well. So we moved on to the next evolution, which was follicular unit extraction, or FUE. Now we took a 1 millimeter coring bit and we took it around that follicular unit. That follicular unit again had 1, 2, 3, or sometimes 4 hairs. We took out that cluster individually and we made a little incision. We planted it in the head. Instead of a linear scar, we took out all that tissue. We have a cluster of little holes and a pretty good result. However, when we took out those hairs, there's about a 12 to 15% chance that there was a transection where the follicle was taken off and the hair never grew back. The oil gland was stripped off and the hair could be dry, or the tissues could be stripped and it can lead to a little kink in the hair. So my opinion, FUT results a little bit better than FUE until the new evolution of FUE technologies came out. Micro, which is something that we really kind of helped pioneer at this office. Multi-phase extraction. We're no longer using a 1 millimeter bit that just cores out the hair. We're just slicing the outside of the skin. We're vibrating that hair out. The transition rates are dropping from 12, 15% down to 2%. The oil gland staying intact, all the tissue staying with the hair. In fact, it's no longer just a follicle. It's the actual hair unit that we're transferring. And now we're going back to the natural appearance of the FUT results, but with the benefit of those small little pokey holes. So in our office, your surgical options are FUE and PUE, and you can choose between either one of those, but they are both great options. PUE resulting in a much more natural result in our hands.